Ladies and gentlemen, we're very glad to have Dr. Sebastian Bele with us today, who's head in andrology, urology, and penile prosthesis. So it's a pleasure really having you here in Jeddah. How's Jeddah treating you so far?
It's my pleasure to be here, to meet my friends and colleagues. I'm very happy to see Jeddah again. I was there a few years ago, and I can see that the city is moving fast, and also offering the population such beautiful facilities, well equipped and well organized. So I'm very happy to be here.
And Dr. همام, Mendora, it's a pleasure also having you.
Thank you so much. We are honored to have Dr. Sébastien Bile here in Jeddah. He's a well-known urologist and andrologist in Europe, all over the Europe, and he's based in Paris. So we are really pleased to have him here with us.
And I understand you trained a lot of Saudis, yeah, doctor?
Yes, we have a fellowship program in France, and I am holding such a program for andrology. And it's been my pleasure for the last 10 or 12 years to host doctors from Saudi, Kuwait, Emirates. And so that makes that kind of trip a pleasure for me, because it's meeting colleagues and meeting friends.
What's your impression about your Saudi students? I hope positive.
Of course it is. Most of them are very serious. These young men are taking time from their schedule to come to meet me in France for a year or two. They have to learn French, and then they are still learning medicine and surgery. And it's always my pleasure to see them progressing and getting better and better with time they spend with me.
Well, I believe it's very nice. The nice thing about training in France is you get the language, you get the culture also. It's not just a matter of the medical material, you get the medical benefit. You also get a cultural benefit out of it.
Yes, actually, most of them will spend 2 years in Paris, so they become Parisian.
Yeah. One of them is my cousin. My cousin, actually, doctor, he's an ophthalmologist, and he spent 6 years in Paris. He learned the language and then practiced in Paris.
Yeah, it's always something that you benefit from when you move from your place to another place and you stay there for a year or two or even more. You always come back a little different than what you were before you left.
It's a pleasure having you, really, doctor.
I'm very happy. He has multiple visits here in Saudi Arabia, so his passport now turned to be green. Yeah, but yes, it is outgoing for now.
I know you're very busy, but there's the Red Sea Film Festival now going on in Jeddah. It's this week. I'm sure you don't have the time for that, but if you had, you can go.
Yes, it's having my pleasure. Actually, from Paris, what I can see is that Jeddah is a very active city, moving fast, and it's a pleasure to see the country changing so fast with such a large young population, making it together. It's very, very impressive for what we can see from France.
So how important is this global collaboration between countries regarding medicine in general and in andrology specifically?
For andrology specifically, what is important for our patients and the trust they have on their doctors, their local doctors, is to see when they go on the internet or on social media that we are all doing the same. Or actually we should, because we are all following guidelines, international guidelines, which are meeting local guidelines. So it's important to show our patient that what we have as a solution for their problem is what solution they could have been given in Germany, in France, in USA, all over the world. Surgeons are working together to bring those patients solution to make their life better.
Amazing. So in terms of centers of excellence and penile prosthesis, what are the key elements, doctor, that we should focus on?
The key elements is first numbers, because numbers means that if you have large number, it means that patient trusts you, especially when you are going year after year with such numbers, it means that you have met their trust. So that's one first thing. Second thing, you have to show that you are working as a team. And again, numbers are telling that other doctors are referring patients to you. So if you are working as a team, a leader, and you are getting good numbers, and if you are able to publish articles or to participate in congresses and show your results, even do some research if you have the opportunity to do it, all this all together will make you a center of excellence.
Brilliant, Doctor. Dr. Hamam, how do you see the evolution going on in terms of the field of andrology in Saudi Arabia?
Yeah, I think in Saudi Arabia there is a big jump in numbers, a big jump in also educational wise. I think now the social media, they open a lot of questions that patients cannot ask before. So now I think it's growing too much fast. There is a lot of expertise now, especially Saudi andrologists coming into most of the private and public hospitals. So I think the growth of penile implant, and I think there is a study now showing how is the growth during the 10 years from patient perspective and the number, and also the conversion from using the penile prosthesis types all over the years. So now it's improved much. I think there is a lot of acceptance in terms of patient perspective and patient knowledge.
Brilliant. Doctor, so in every culture, there are certain rumors about what makes a man very active in terms of unhealthy sexually, for instance. I want you to tell me some of the misconceptions that are in the French culture about this area. Like, what do they believe are aphrodisiacs, for instance, in France?
Yes, this is something that we will find anywhere in the world. There are always local beliefs of food and stuff that can make you act better. There is something in France about red wine.
Okay.
Supposed to make you more active, which is not the case actually. And some foods also, like shrimps or oysters, should be an aphrodisiac, which so far has not been proven scientifically.
They're not scientific. No, we also have the same thing about shrimps here and seafood.
Yeah. Even the cultural belief here, our people, they are doing more malleable penile prosthesis other than inflatable. But I think in Europe, the inflatable is much higher than.
Yes, inflatable in Europe, the mix is like 8 patients will go for inflatable and 2.
So 80-20 around.
Yes,
80-20. You know, here is still in public hospital. It was before 70 malleable and 30 inflatable. Now it's reaching almost the same 50-50, or the inflatable getting higher. This is also one of the patient difference between Middle Eastern and some Western. Despite that, our people, they can marry 4, but they can marry. So we desire to have.
Not everyone can marry 4. It depends on how lenient.
Yeah.
But it's in general. One is the golden mean.
Okay.
So, sir, I want to ask you. So, what's key to having a healthy, to maintain a healthy sexual or to maintain healthy men health in this area?
So I would say there are several keys. Of course, one of the major key is food. It's most of the keys are habits, but food is a very important one. Try to limit the sugar that you can get. Of course, sodas and sweets are very bad for your blood vessels, and what's bad for them is bad for your erection. And plus, they are bad for your libido also. The sex drive can be slowed by the fact that you are gaining weight and you are making less and less testosterone. Exercising is very important. Not as much as being an athlete, but having average exercise, walk, and try to do some sport if you can. Try not to smoke. All these are very important for the quality of your erection. Having a good pattern of sleep is very important for your libido and for you to build enough hormones, testosterone, to have a sex drive. And having a good life with your wife also is very important.
That's very important.
So what they
A
say,
good relationship is very important.
yeah, happy wife, happy life. That's very important. So do whatever it takes to make her happy.
Amazing, amazing, doctor. So when does a patient need to go through the penile prosthesis procedures? When do you recommend such procedures happening?
I usually start to tell my patient about this solution when I see that medication is failing or the efficacy is fading. When oral medication is not doing the job anymore, I want them to know that there is a solution. So there will be less stress on them because they will know there is a solution. And second, when I will come up with this solution, if they really need it one day, they will not see it as something very strange. They would have heard of it before. Because when those patients are totally despaired, if you out of nowhere you talk to them about the solution of penile implant, if they never heard of it before, it's difficult for them to accept it. But now with social media, they tend to know about it quite early.
What do they fear most about the surgery?
They fear surgery, like we all do. Nobody wants to have surgery or general anesthesia. But once you tell them it's a routine surgery, it's a short procedure, a few dozens of minutes. It's a short hospital stay. Some doctors are well trained, used to it. Imagine more than 150 cases per year. So it's it's a routine surgery for us. It's an elective case. So that's the first thing. So safety. And then efficacy. We have several papers in the medical literature showing us that this solution is a good one, is a solution that patients like once they get the surgery. Because not only is going to give them a good erection, like Viagra or Cialis could do also when it works, but it's going to give them more self-confidence at any time, even when there's no sex. Actually, that's what I tell my patient. This is going to give you a good erection, great, but most of all, it's going to restore your self-confidence, your quality of life. And your wife will find you much happier, much funnier, much eager to do things in life globally, exercising, going out with the kids, because this problem is over.
So there's a psychological aspect also to it,
Of
not
course.
just a physical aspect.
Yes, because erectile dysfunction is devastating on the psychological aspect of life. And we are repairing this problem.
Sometimes females tend to be a bit sensitive about the fact that a male is using erectile dysfunction solutions such as pills or so whatsoever. What do you believe is important in terms of education? Because it's a very common thing, erectile dysfunction. So sometimes the reaction could be negative towards it. They feel like they're not wanted. How do you deal with such cases, doctor?
For patients who are still on pill medication, I tell my patient to discuss with their wife, to explain them that the pill is not an aphrodisiac. The fact is they want to, but they cannot. Even if the wife cannot see it, it's like being paralyzed, but nobody can see that you are in a wheelchair. Okay, only you know it. So if you tell your wife, I would like to get closer to you now and everything, she will not believe that you took the pill to have the will to have the intercourse. So it's just a matter of I would like to, but I cannot. And with the pill, I can.
Right.
When it comes to surgery, I tend to tell the wives when they are with me in the clinic with the patient that she should see it just like a breast implant, breast reconstruction after cancer. Okay, no one has the right to ask the lady who is getting a reconstruction, who is she going to show her breast to? Okay, what is she going to do with the new breast?
Yeah.
It's only reconstruction. The same. They say you had cancer and you lost your erections. We are just making it working again. So there is no fear for the ladies when they see their men going through surgery. They are not going to lose their husband. No, there's no reason why the husband should change in a bad way after he gets the surgery. It's only restoring normality.
Usually, what's the age range of people who do?
It does to get lower and lower, actually. Now, I think the average would be 50. It used to be 65, 70 when I started 20 years ago.
Why do we have this?
Because we have more and more Peyronie's disease, first. That's a global trend. You will see it globally, more and more young people getting Peyronie's disease. So it means that after 10 years, they tend to have bad erection and go for surgery. We have a lot of Peyronie's disease in men in their 30s. So 10, 15 years after that, some of them will need surgery. Then we have a global epidemic of type 2 diabetes, with young people having a non-controlled blood level for years, and it's destroying their erections. And we have a lot of smokers also. And plus, now patients are aware that penile implant is a good solution, so they will come sooner, earlier to their doctors. They will not wait for 10 or 15 years before going to the clinic, which was the case before, because nobody was advertising for this solution. So people had to find on their own and to discover that a doctor was doing the penile implants. Now everybody knows about it. So people, as soon as it doesn't work with the pills, it will come to their doctor.
Exactly. So the environmental factors increase, like that bad dietary habit, no exercise, increase smoking, all this stuff. Plus, there is increase in awareness regarding penile prosthesis. It's not, it wasn't like this before. So no one knows about penile prosthesis. There is another solution that they can be offered after failure of medical treatment. So that's why maybe the prosthesis growth is well seen now.
So, as a private sector, as a doctor in this area, what do you believe is your role, Dr. Hamam, in terms of prevention of or improvement in lifestyle?
So first of all, we have to educate the patient to get all the chances to get more education and awareness in this area, especially in our region here in the Middle East. I think there is a lot of barriers. A lot of people, they are a bit shy to counsel regarding his sexual life, and all the information they got from friends and from people that are not specialized in this field. So first of all, being presence everywhere in the clinic, in the podcast like we're doing here, and social media, this is really important for spreading awareness regarding this all behaviors needed for good erectile function.
Brilliant, doctor. Regarding the infections that occur after the surgery, many people have this fear that infections could occur post implants. Is that true?
Yeah, I think it's infection is true. Yeah, there is a risk of infection, but what the people mostly fear from infection is the rate of infection is very low. In a specialized center, it's less than 1%. In a specialized high volume center, it's considered to be something very minimal. There is always a risk, but it's very minimal. So this is not the reason to stop doing or to stop stepping to the next step, which is inserting canal implant. So it's always there, but in high volume center, specialized centers, they are taking a lot of precaution to avoid any of this risk. First of all, having antibiotic coated implants, controlling blood sugar and controlling comorbidities of the patients. Also, following up with doctors, it's really important. So if you discover anything, they can maybe have a precaution to happen. So this is really important. What do you think, Dr. Bene?
I think you're totally true. They have to know first that even if an infection occur, we have solution. We will do what it takes to treat the infection, but the patient will not be let without erections after that. There is always a solution. And the rate of infection is less than having a hip or a knee prosthesis, which is a very common surgery. So,
especially in a people who's doing this procedure routinely. Yeah, if you come to the, for example, general urologists who are doing 2 or 3 cases per year, yeah, you can find a lot of disaster.
yeah, it's
disasters.
yes. It's like any surgery. You need to go to an expert.
Brilliant, doctor. So what should the patient expect post-surgery?
Post-surgery, the patient should expect that he will feel mild discomfort for 2 weeks. He has to rest. He has to follow his doctor's guidelines. Try not to smoke. Balance his glucose, his blood glucose, and get some rest for 2 weeks. And after that, slowly, he will recover his normal activity after 3 weeks. And whenever the doctor says it's okay, then he will be able to recover his sexual activity again.
Brilliant, doctor. It was a pleasure having you. I'm really delightful for having this interview with you, and I hope you enjoy your rest of your time in Jeddah.
Thank you very much. My pleasure to meet you all here, and congratulations for such a very nice facility, well equipped, and filled with good doctors.
Thank you, sir, and I really appreciate Dr. همام for giving me this opportunity to meet you. I was very excited when Dr. همام first told me about this, and you're welcome to have any people of expertise who are willing to talk in our podcast. So it's a pleasure.
So it's really an honor to have him here with us, and coming a big name like Dr. Sebastian coming here in our institution. It's a good opportunity, first of all, to sharing knowledge, and also to refine some surgical steps, having a lot of guidance with him, and this is really priceless. Thank you so much. Thanks for having me. My honor.